most famous physical therapist on the internet.
Hi folks, I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, Bob, in our opinion, of course.
Today we're going to talk about how to stop inner knee pain. That means on the inside, right? Or inner in the joint.
In the joint.
Oh, in the joint,
Yes.
knee pain, and avoid surgery. We got 4 specific options.
Right. So, Bob, this is something that typically we're talking about arthritic pain.
The joint has wore down.
Yep. The cartilage is not doing well, and you want to avoid surgery. The good news is oftentimes, I don't know what the statistics are, but it's worth the effort
Absolutely worth
to
the effort.
do these steps to avoid surgery. As a matter of fact, in my mother's case, she has a knee problem. She has some medical issues where surgery is not an option for her.
It's not warranted.
Right. So these steps
She
working
has
on.
to do these.
Right. Exactly.
And I think you don't want to get caught up in the idea that it's going to get progressively worse. It may, but it may not. It may stabilize.
Right.
Or it may even get slightly better,
Right.
according to studies.
Right. So you go to your doctor, you got knee pain, they take x-rays, they say, oh, you've got arthritic changes.
Maybe bone on bone.
Yep. And then hopefully the doctor is going to say the first option is going to be exercise or therapy.
Physical therapy.
Right. And if the doctor does not go that and goes to step number 2 and wants an injection, you can interrupt them and say, or her. Yeah, good point. I think maybe therapy, is that an option? And oftentimes they say, oh, well, yeah, if you want to try that, please do ahead. And they'll write you up a script for physical therapy. The exercises are not really something that's special. And we're going to show them to you right now.
We have a lot of them on our website. Which we will have on the knee program. But we also have a lot on YouTube.
Right. Just put Bob and Brad knee pain exercise.
And off you go.
Right. So the big thing is to get the joint moving. So we want to get that joint moving, and typically in a non-weight bearing fashion. In other words, not walking. We're not doing deep squats. We're going to try to get that joint moving so that synovial fluid, the natural lubricant, gets in that joint and helps make it feel better, get it back to moving.
I know you mean, by this, Brad, that if you can walk and there's no pain, by all means.
Right. Yeah. Exactly.
It's if you're walking and you're really limping because it hurts, then you probably want to do non.
Yeah, that's a good point. Yeah. If you can walk for 200 yards without pain, then absolutely walk.
Right. Absolutely.
Right. All right. So let's say you're walking, you've already walked your distance. It's like, it's starting to hurt now and it's getting worse. Then you're going to give it a break and you can start doing simple kicks or long arc quads, we call them, working that joint, working the patella, bring it up as far as you can and back down. And it's important that you really do it in a nice controlled manner. You're just not kind of arbitrarily
so you're
flopping
getting motion, plus you're getting some strengthening.
Exactly.
And it's a good one to do quite frequently.
Yes.
You could do it like every hour.
I've had patients specifically, I say, before you get up and walk, do 10 of these on your sore knee. And they say, oh, yeah, it doesn't hurt so much when I get up and walk if I get it moving prior to the weight bearing of the walking. The next thing is, you can do what we call floor scrubs. And now you can't do it on carpet because it sticks, but in your house, if you got a smooth floor, you can throw a towel down. You can go back and forth like that. We specifically
We have a couple products, and these are really good for if you are going to have surgery.
Yep.
But even if not, we got the Fit Glide.
Yep.
And you can actually, in bed, you want to slide it down, Brad, a little bit. There you go. This is one of the few devices you can work your legs while in bed.
Right.
And easily.
Yep. And it's very light. This one, that one's for both legs. You could use one for one leg.
And then you can take it and put it on the floor in a seated position.
Right. And you could do this with both of these. Now, this one people usually use that know they're going to have surgery.
Right.
Either before surgery or after.
Because you're only working on one leg.
Right. There we go. I wanted to get so we're doing that. The nice thing about the knee glide is you can put it at an angle, which does give resistance in both directions.
It's got a little stand. Like you can do it on both
Yeah,
sides.
and you can do it carpet, then it's not a problem. So keep the knee moving, keep it strengthened, and you can do squats if it's pain-free.
Especially shallow ones you may start off with.
And you may have a chair like this, so you're going to have your hands here. Go down when it starts to hurt, go back up and just do mini squats. And after time of doing this, hopefully you're able to go deeper without pain, which is a good sign that it is improving. You're getting stronger, the joints starting to recuperate.
Yeah, you're just touching upon it. And there's really a lot of exercise.
There is.
And you're trying to increase the natural fluid.
Right.
Natural
synovial
lubrication.
fluid.
Yeah.
The other thing, which is a really good exercise, but most people don't have access, is pool exercise. Getting in the water.
You get some weight bearing. You can walk in the water, basically, you're saying, or maybe do aerobic exercise.
Right. There's oftentimes classes that, but walking in water this deep takes a lot of pressure off. You get motion.
Yeah, resistance.
Yeah. Now, once you get through all of that, number 2 is a
While you're doing those, by the way, you can take ibuprofen or
good point. Yep.
Tylenol.
Some over the counter.
If your doctor agrees.
Yep. Yeah. Depend on the other medications, but it's oftentimes a good combination. If that's not working, or it's working, but it's still a problem, and you need to discuss this thoroughly with your surgeon or your doctor, a cortisone injection, where they actually take an injection into the capsule that's into the knee joint itself, and it's like an anti-inflammatory.
Corticosteroid, I believe.
Yep.
Yeah, and the studies have shown this is worthwhile trying.
Right.
It's got benefits, especially with people. Extends the time.
Right. And in the case like with my mother, and I think this is pretty common with the injection like this, every 3 months, if it helps, it's getting better. It won't last forever. Hopefully it'll get 3 months, because they don't like to do these injections
more than
every 3 months, because it can cause problems with the joint, because it gets a little too aggressive for that.
A lot of side effects. I mean, if you do too much.
Right. And I'm not going to get into the side effects. You can talk to your doctor about that.
Yeah.
But that's a real common protocol. And this will vary from doctor to doctor or
institution to institution.
Exactly right. The next injection, that's the next step up, if you will, would be the Synvisc injection. This is typically a series of 3 shots. It does not take effect as fast as the cortisone. You may get the first injection and they'll say you may not feel any relief off of this. It may take a week or so. And then you get the second one and the third one. However, if this, and I say if because it doesn't always work, if this system works, usually it lasts quite a bit longer than the cortisone. Gotcha. So again, this all has a lot to do with your joint condition, your weight, your strength, your range of motion.
But there are things you can bring up to your doctor.
Yeah. So it's very individual. So we've got the cortisone, the Synvisc injection, and this is a newer one, at least at the hospital that I'm familiar with, is the radiofrequency ablation, where they actually go in with radiofrequency to the nerves that tell your brain there's pain in that knee, and they ablate them or kind of destroy them. So they're not working anymore. And this is something that they're doing with backs now. You just talked to a doctor.
They're doing with backs, and also we know one surgeon that does it before the surgery to lessen the pain while you're recovering.
So you don't need as many pain medications.
Right.
So this may or may not be an option where you go. You can ask them about it.
I think it's a promising area.
Yeah, I think so too. What they do at the facility, and I'm going with my mother, they will do injections to those nerves and get them numb.
To test whether or not it helps.
Right. So you inject temporarily numb up those same nerves. Gotcha. And if that takes care of the pain temporarily, that's a very good sign that you can do the ablation and it will be successful.
Makes sense.
Yeah. So that's 4 options. And particularly if your option for not having a knee surgery for what your heart's not, strong enough.
Or if you want to try some more conservative things. These are it.
Yeah, absolutely. So that's 4 things to, toss around in your head. Talk to your doctor about it. Again, it is an individual thing between you and your surgeon.
And our giveaway today.
Oh,
Brad.
yes,
By
this
the
is
way,
good.
This is a big giveaway.
I don't know if it's going to help with knee pain, but it's certainly going to help with sleeping.
Yeah, that's right. So we're giving away the Sleepovation mattress.
Right.
And you can pick out the size.
Yeah.
This is just a sample of one.
Right.
It's got 700 tiny mattresses.
Yeah, right there they are.
Very much a mattress for people who are in pain. I think, you know, personally, I have heard testimonies from family members and friends who just, this is the most comfortable mattress they've been on.
Because you let them sleep in your bed?
Well, we have one at our cabin.
Oh, the spare bedroom.
Yeah, the spare bedroom.
People fight over it?
Yeah, well, they fight over it, then they want to get one after they slept in it. So,
no, I have one too. I really do. As well as my wife. We enjoy our mattress.
Yep.
And
so go to bobandbrad.com, go to the giveaway section. You can sign up for the giveaway. You can also go find it on Facebook.
Pinned to the top.
Pinned to the top of the page. And you might as well subscribe to us while you get there too.
Right, you hit the subscribe button and do something else.
And then the podcast.
Oh,
Our
can
podcast.
you subscribe to
yes,
podcast?
You can subscribe to podcast.
How do you do that on the radio?
It's a radio. Yeah. On the
well, it's kind of like a radio.
How do you do it on the phonograph?
Yeah.
Oh.
Just
all right.
Be careful, whatever happens.
Be quiet.